Tonight, let's look beyond our own closed borders and see what the rest of the world can show us about living with COVID. Has the time come to give up on COVID zero? We face some big questions. What risks are we willing to live with here? How many cases will we accept? How many deaths? Welcome to Q&A. Hello, welcome to the program. I'm Stan Grant. We're coming to you from Sydney tonight on what's been, yes, another dark day in this pandemic. 5 deaths in New South Wales and Victoria now in its 6th lockdown. Our questions tonight come from all over Australia and the world, and so does our panel. Joining us, CEO of the Property Industry Foundation, Kate Mills. Former New Zealand Prime Minister Helen, who led the independent investigation into the global pandemic response. The New York Times Australian Bureau Chief, Damien. In Washington, high-profile epidemiologist Feigl-Ding and vaccine specialist from the University of Sydney, Julie Leask. And from Jakarta, Chief Editor of the Indonesian TV network Rajawali Televisi, Yulia, Supadmo. It's great to have all of you here with us tonight. And you can remember, well, you can stream us live on iView and, of course, all the socials. Quanda, as usual, is the hashtag. Please join the debate. We love to hear what you're thinking. Our first question comes from one of many Australians trapped overseas, Sophie Hamblin.
Hi, my name is Sophie. I'm an Australian currently living in London with my 10-week-old baby and husband. I have a question for Q&A tonight. I would like to know what Australia's long-term plan is, given that there aren't enough vaccines to go around, and it's unlikely that the uptake will be strong enough to meet that 80% rollout. When will national and state borders reopen? When can Australians return home? What's the long-term plan? Can Australians still call Australia home?
Julie Leask, what a day to ask that question. Victoria going back into lockdown, as we mentioned, New South Wales seeing the numbers continue to creep up. That question about when do we get to the end of this, when do the borders open, seems a long way away, doesn't it?
It does right now. It feels like fairly dark times with Delta around and having such a struggle to control it here in New South Wales and outbreaks elsewhere. I think fortunately last week we had some targets released by the Prime Minister from that modelling from the Doherty and colleagues, which suggested that around 80% they were going to allow people into the country if they were vaccinated from overseas. So I think it's nice to have that goal to work towards, but I appreciate that that could take some time. And in the meantime, there are families who are separated in this way and people who can't get home. And it's just one of those very, very difficult things about this pandemic.
Kate Mills, even at 80%, and just going to that Doherty Institute findings there, their own research, we're still going to have potentially thousands of cases, and they're warning that in the worst case scenario, you could have over 1,000 deaths a year as well. Are we ready yet to have that conversation, even at 80% of what life might look like?
I think it's going to take quite a long time for Australia to get to that conversation, and that's because of the very specific strategy that we have taken, us in New Zealand, which is about having 0 deaths. Versus when you compare it to other countries and the most of the world where they've I hate to say it, they've got used to those numbers, if you like. So if you look at what's happening in the UK at the moment, and I note that Sophie was wearing no mask and out and about on what looked like the South Bank in London, where because people have got used to those horrific numbers of 50,000, when they come down to 25, 26,000, people start to feel more comfortable. I think for us, it's obviously going to have to go the other way. And it's interesting to see when in New South Wales where you've got 200 a day at the moment, and people do start to get accustomed to that number. They start to go, I'm expecting the number to be around 200. So for us, we're going to have to travel in the other direction. In the end, and we're going to be talking about this a lot, I think this is, we talk about this being a race. This is a race where we only win when everybody gets to the finish line. Like if the UK is sick, we're at risk. So we've all got to kind of arrive there at different times. The real question is going to be when we get there and you look back, do you think you took the right route? And at the end of the day, I think Australia's taken, a route that only it could take because of what happened right at the beginning when we closed borders quickly, which is going to give us a very different result, which is going to be fewer deaths.
Can I bring you in here, Helen, and just get your assessment of looking at what's happening in Australia, looking at New Zealand as well, and you've had similar issues there around vaccination, you've had issues around lockdown, we've had a travel bubble with Australia, which is then, we've hit pause on as well. But how do you see Australia right now and where it is positioned?
Well, Australia's approach has been very similar to New Zealand. It's been a zero tolerance approach. You see it, you try to stop it and stamp it out. Obviously, you've got quite significant hiccups at the moment, particularly with the New South Wales numbers, and I note the development of Victoria today. But looking at it from a New Zealand perspective, we're pleased that has been the Australian strategy. It means that at some point our bubble can reopen, and there's a lot of links both sides of the Tasman. I don't see the strategy changing here anytime soon. Kiwis rather like being able to go to their concerts and their football games and get out and about. And I think that they're prepared to put up with some isolation and keep those benefits.
Eric Feigl-Ding, can I just bring you in? And thank you for joining us. I don't know what the time is there, but I think it's very, very early in the morning, so I appreciate you giving us your time. Can I wind the clock back here and go back to when we first heard of COVID? You've been called one of the prophets of COVID. You tweeted at the time. Give us those exact words of what you tweeted when you thought, oh, what are we dealing with here?
Well, thank you for having me. Well, Memory Road, if you rewind about 18 months to January 2020, I had once said, this is going to be a thermonuclear level bad pandemic.
I think you'd use the word Holy Mother of God, I think was the phrase you tweeted.
Yes, I also use Holy Mother of God. But I think in certain ways, you have to captivate people and make them listen, because it was during a time which people just were not paying attention anywhere in the world, unless they were China hawks and watched everything what was happening in China, which most of the world did not. And this was really, really scary. The data that was coming out of China, it was real. China had no strategy around the communications around it. It was as real as it can be. The signals were bad, but a lot of the Western scientists and leaders just did not have their ears to the ground. So in order to get the public attention, I had to go with Holy Mother of God. This is going to be a thermonuclear level bad pandemic that rivals what we've not seen since the pandemic of 1918.
You certainly got a lot of
millions of people have been affected.
You certainly got a lot of pushback and a lot of criticism for that. Some accused you of being alarmist. Yes, a lot of the things that you pointed out then have come to pass. The numbers of deaths in the United States, but you were accused of being alarmist and to generating this narrative of fear. Do you look at that then and say, well, I could have chosen different words, or I could have approached it differently?
Well, people cannot quite imagine what they've never seen before in their life. So yes, it was alarmism, but alarmism is clearly relative to what we've experienced in the last 18 months. A healthy bit of alarmism, and I'd rather say precautionary approach. There were people who said there was no evidence of human-to-human transmission. There's no evidence that asymptomatic transmission occurred, hence we don't need to mask if you don't have symptoms. There's people who said it's not airborne, and people said it's not airborne for over a year before finally the world recognized this is really airborne. And then people said there's no such thing as reinfection. Once you had immunity, you'll always have immunity. That's clearly not true. And right now, the Delta variant, we've been screaming about Delta variant since April and May, when India lost estimated at minimum 1 million to likely 3 million deaths in 2 months alone. And we've been saying it. WHO declared variant of concern first week of May. CDC didn't act until June 15th. UK acted mid-May, but people were still asleep at the wheel. And a lot of leadership, we want to hope. We really want to hope that COVID is over. I want to hope COVID is over. But if you watch what's happening, it is not. And if we saw the data from Singapore, it was clearly showing that there was vaccinated to unvaccinated transmission, asymptomatic transmission, and the vaccinated people could still transmit, which means high vaccination countries like Israel and the UK were not out of the woods. And lo and behold, we are seeing surges around the world, even in highly vaccinated Israel, and the vaccine efficacy has been dropping there ever since Delta has been invading. And US, with 55% fully vaccinated, is seeing surges in 48 out of 50 states.
Yeah.
And we're having a, sextupling of cases in the last month, and hospitals are at record highs in Florida. So you cannot argue about that. And we are way more vaccinated than even Australia.
And we're going
we're not in the clear.
We're going to get to a lot of those questions, the impact of Delta, the questions of vaccination. We want to go to one of the areas that has been directly affected by Delta and one of the epicentres right now, if you look at the rates of infection. And our next question comes from there, Namira Jawas in East Jakarta.
Hi. Here in Indonesia, the pandemic doesn't seem to slow down. More often than not, I, like a lot other, live in fear and constant worry about our health and safety. Nonetheless, more and more has slowly embraced this new normal and accepting that maybe this is how the rest of our lives will be. However, I have underlying concerns as of when can we reach herd immunity here in Indonesia, where there's barely enough people getting vaccinated. So far, we have only reached around 6% of the total population. And when is it really safe to stop calling it a global pandemic? Thank you.
Yulia, Supadmo, so much concern there and worry about what it's going to mean for the family. You're there as well. What are you experiencing right now? What is life like where you have been at some points registering up to 50,000 cases in a day?
Well, it's now a matter of managing your stress level, especially for us journalists here on the ground that are still required to cover this pandemic out on the field, especially our colleagues, the reporters and the camera persons who are out there on the field. Now, someone mentioned about a lot of leaders maybe took for granted this virus in the beginning, and critics of the Indonesian government have maybe said something in the line of maybe the Indonesian government was a bit relaxed at the wheel. I think that was the sense that we got after the Muslim holiday of Eid al-Fitr. So I think what took us by surprise was the entry of the Delta variant in Indonesia, which basically made the cases spike exponentially. Now, I know that Sydney has been in lockdown for 6 weeks and everybody seems to be in a panic after the number of deaths there, but you can imagine now the number of deaths in Indonesia have reached some 2,000 in a day. Now, the lady who posed the question said that this is the new normal that Indonesians have now tried to embrace. However, it was exactly this mindset that got us here in the first place. July was definitely one of the worst months for Indonesia because of the Delta, and the hospital facilities and infrastructure was just not ready for the number of cases that grew. You can imagine the government, I think, in the past 6 months have tried really hard to keep up with the pace and try to do better. However, because of Delta, the number of hospital beds, the medicines, the supplies, and even the vaccination rollout have not been able to keep up with how fast Delta is moving in the country. So if we're talking about when can Indonesia breathe a sigh of relief, I don't think it'll be a while, at least until the end of the year. Even the government has scrapped its idea of reaching herd immunity. As of today, the percentage of people vaccinated has reached about 10% of the target. And I think we'll still need a long time before we can basically breathe easy here.
And Damien Cave, you've reported a lot on what the responses have been throughout the region in Southeast Asia. What do you think is an indication of the way that it's been dealt with, and how countries are dealing with particularly these other strains, such as the Delta strain, obviously clearly having a devastating impact in Indonesia?
I mean, these variants are a game changer for the entire region. You know, Australia is far from the only country that did really well with the first phase of COVID and is now really struggling mightily in the second phase. Japan, South Korea, Taiwan, Singapore. Many of these places thought they had it licked, and it turns out that they don't. But part of the problem, I think, and part of the challenge is getting people to have a fair understanding of what the expectation should be. Perfection is impossible with COVID. We should get rid of this idea that we're all going to be able to go back to normal anytime in the near future. That's simply not the reality that we're seeing, especially with these variants. What we have to figure out a way to do is how to do as well as we can in the moment. And I think a lot of countries are trying to figure that out, and the range varies quite a bit. The thing that's really heartbreaking when you look around the world is that there's such inequality in terms of how vaccines are rolling out, excuse me, in terms of which countries are doing better than others. And unfortunately, a lot of it is tied to wealth and who has the power or distribution or ability to make vaccines. And so the world has an enormous challenge ahead. To some degree, you know, this isn't the beginning of the pandemic, but it's so far from the end. And there's a lot of work that needs to be done.
And Helen Clark, this is what you warned of, wasn't it, in your report, that there were things that could have been done and weren't done, and responses now that we have not learned from experience, particularly when it comes to providing vaccine for other countries. I mean, you listen to what Namira Jawas, our questioner, said there, 6% of vaccination and clearly dealing with this increase every day and tens of thousands of cases. This is precisely what you were talking about in your report.
Absolutely. The report that came out in May expressed great concern about the pandemic just rolling on, with the possibility of more and more challenging, maybe even more lethal, who knows, variants emerging. And vaccination is extremely urgent. The WHO has now articulated a goal, which would be to have 10% of the global population vaccinated, for example, by September. I understand it's about 1% now, so the chances of meeting that are pretty grim. We don't have enough vaccines in total being produced in the world. The high-income countries have ordered twice as much as what they need, and our panel said get them out there to low and low-middle income countries. But we also need radically scaled-up production. We're starting to see some more agreements, for example, to produce in Cape Town, produce in Senegal, whatever, but it is slow. Unless we can reach the WHO's target of 70% by mid-next year, and 70% really isn't high enough, you know, this is going to roll on, and our lives will not return to anything like the normal that we knew. Well, maybe if ever. I'm on the pessimistic side of this.
It's certainly a game changer, and lives have certainly been altered. And critical to this is the question of vaccine. We want to continue to focus on that and get a response from our panellists. Our next question comes from Mustafa Ersoy.
Hi, I'm a first-generation immigrant, hopefully with many more generations to come. My immediate family resides in Turkey and in the Netherlands. I'm particularly concerned about not being able to visit my parents in Turkey, who both recently had their Synovac vaccines. My question is for the panel. Firstly, what are your thoughts about the Synovac vaccine? And when the borders start to reopen, will or should there still be travel restrictions in place to and from those countries that did not choose either the Pfizer or the AstraZeneca vaccine, such as Turkey, China, Russia, and Indonesia?
I want to come to you, Julie, on that in just a moment, but let me go to Eric Feigl-Ding on that. Let's talk about Synovac and how that differs from the other vaccines. I mean, here in Australia, we talk about Pfizer and AstraZeneca. Just quickly let us know what the difference is and what the efficacy of Synovac is.
Yeah, that's a very good question. Synovac is an inactivated vaccine. So it's not a spike protein vaccine that is either mRNA or the adenovirus like the AstraZeneca. It's basically a virus that's been killed, deactivated, and it's a whole virus that's been presented. Sinopharm is also a vaccine like that. Sinovac's used in Brazil, Chile, Turkey, and many other countries of the world. It is WHO approved, but the issue is there is studies that shows it's a little bit lower neutralizing in ability compared to some of the mRNA vaccines, and even compared to AstraZeneca, which has slightly lower neutralization compared to Pfizer and Moderna. But it's still a very good vaccine that protects you well against hospitalization. So although the efficacy has often been 50%, 60% or less against total infection, before hospitalization, it's still always been over 90%. So it's a really good hospitalization prevention vaccine. Now, that said, we don't have good data on Sinovac in the Delta variant, and that is somewhat of a concern.
Yulia, when it comes to people being vaccinated in Indonesia, Synovac is one that is being used there?
Yes, it is.
And what is the confidence level? I know that there has been so little take-up of vaccine, but in your conversations with people, is there a hesitancy or is there a confidence? Is it a supply issue? What are the issues?
Well, in the beginning, for the government, it was the supply issue. You can imagine at the start of the pandemic when countries started to produce vaccines, it was basically a race to find and obtain the vaccines. Now, having said that, I think the government, the mindset in the beginning was we have to get vaccines as fast as possible. And in the beginning, Synovac was the one that was available or made available to Indonesia from the Chinese government. So with that mindset, I think the idea was to get the Synovac vaccine here as fast as possible for the medical workers and for any other frontliners to get vaccinated first. Now, more and more vaccines with other brands such as Moderna, Pfizer, and AstraZeneca, including from Australia, have started to come in. However, you can imagine in the beginning, those weren't available, and getting the vaccines is not easy at all, as you may know. And we've been grateful for the help of countries like Australia, the UK, Japan, and the US, which has donated vaccines for Indonesia. Now, Indonesia is lucky because we take it that we are relatively politically strategic, so that we are able to access these vaccines easier than, I suppose, other underdeveloped countries that require vaccines but have not obtained any. But in terms of the confidence level, I think a lot of Indonesians, depending on who they are, what their norms and belief systems are, and how much they are exposed to misinformation or malinformation, those that want to be vaccinated and those that do not is basically now 50-50. I think more and more people have been convinced to get vaccinated, especially with a lot of the policies that the government has implemented, has made it mandatory for people to be vaccinated if they want to be able to go outside and basically enter certain establishments, something like that.
Yulia, I know you have to leave us in just a moment, but before you go, I just wanted to talk about what life is like. I mean, we see what life in Sydney is like at the moment, with just over 200 cases a day, with people in lockdown and lockdown being extended. When you are living with those sorts of numbers and that level of low vaccination, what daily life is like and what the impact is on people's lives, and I understand your own family's been impacted directly by this as well.
Well, to put that question into context, I think people still have to remember that Indonesia is basically a very diverse society with different and very challenging living situations. The middle and upper classes will have the luxury of a two-story homes where they can self-isolate in peace and relatively calm. If you were living in the more crowded areas, if you were living with 5 or 6 family members in a one-room accommodation, you can imagine what having to live at home for long periods of time can be like. It's very stifling, and you're constantly living in fear whether you should stay at home and be safe from COVID, or you still have to leave and go outside so that you can feed your family. You have to remember there are 78 million informal workers in Indonesia that still have to make a living, and it's always a struggle for them to have to comply to any kind of social restrictions that the government implements. So it's this balancing act of keeping you and your family safe, having to let go of the fear because you still have to go out and make a living. So this is the struggle. And you have to remember also that many people in Indonesia still don't believe that COVID actually exists. And this is obviously a product of misinformation and malinformation that I know a lot of countries are also facing. And having that kind of situation here in Indonesia, I don't envy the government at all in trying to manage this pandemic, because for us, it is basically just waking up every day and hoping that you or your loved ones don't contract the disease. And, you know, if you do contract it, I think everyone is just praying really hard and hoping that somehow they will make it through, somehow they will be able to get a hospital bed. And if you don't, you just have to count your blessings and hope you make it. But having to keep that hope alive is actually a challenge now for many Indonesians.
Yulia, our thoughts are with you and others in your country, with your family. Please stay safe, and I certainly appreciate you giving us some of your time on the program here tonight. That's where we say goodbye to Yulia. Our next question tonight comes from Kainwen Opie.
My sister is a nurse in the UK. There are less deaths, but there are still high cases. there are increasingly young people suffering from COVID. When are we going to vaccinate our youth? How do we live with a virus that will potentially cause chronic illness and possibly disability in our young people?
Julie Leask, that's been one of the characteristics of Delta, isn't it? We're seeing it in younger people. We've already seen now here an urgency of younger people getting vaccinated. It is now a focus, isn't it?
It is indeed, and it's whether it's actually more risky for younger people. We don't have hard data on that yet. It looks like it is from the accounts of doctors in ICU, nurses in ICU and so forth. And that means that we're going to have to very seriously look at vaccination of younger people. Now, we've had the Pfizer vaccine in Australia licensed for 12 to 15-year-olds now, and recommended for those young people who are at particular risk of COVID, but not all younger people. So that means that there is going to be this gap in younger people and younger children that we have to think about. Now, it's going to have to be a staged approach because we want to be able to vaccinate the most epidemiologically important groups who are putting us all at risk now, which now we've learned recently the focus for Australia will be the 20 to 39-year-olds. So that's going to be an important focus because then that will reduce the pathway of transmission to older people, to even younger people.
There's been so much mixed messaging, hasn't there, though? We heard initially you should wait for Pfizer, then it was, OK, you can get AstraZeneca, go and see your doctor. Then there were questions of supply. Messages that we got from, for instance, from the Chief Health Officer in Queensland, who was raising concerns about what the impact and the potential risks of getting an AstraZeneca vaccination if you were a younger person. That hasn't helped, has it?
It hasn't helped, and it's been a product of dealing with uncertainty because when ATAGI, our eminent advisory group on vaccines, made that original recommendation about preferring Pfizer for the under 50s on the 8th of April, we had virtually no community transmission in the country. Now, we knew that we could get community transmission, which is why they said we prefer Pfizer for the under 50s, but we're not banning AstraZeneca for the under 50s. And there needs to be a risk-benefit discussion. And they also primed us for the future where there could be more COVID. Now, you know, looking in retrospect, some people are saying we should have had a more forthright recommendation for vaccination and one that didn't sort of turn so many people off AstraZeneca vaccine. But you're still looking at a risk-benefit balance. And I think then what becomes important is clear communication from government, because ATAGI give advice, but it's up to government to then turn that into program advice, get unity from all the states and territories around what that advice is in relation to vaccine recommendations, and then communicate that very well and clearly, including for the health professionals giving vaccination. And that has been one of the major problems with all this that's resulted in so much confusion and the fact that the risk circumstances changed.
And that's what's key here, Helen Clark, isn't it? Is that we're dealing with a bouncing ball. Things are changing. It's like grappling with a column of smoke, isn't it? You get hold of it, it shifts and it changes again. Getting clear messaging, getting all those ducks in a row, getting the health advice, the political decisions, then the take-up from the people is critical to this. Just from someone who has obviously been very involved in COVID, but has also been heavily involved in government. Take us through that decision-making process and dealing with an emergency that is ever-changing.
Well, firstly, in this day and age, you're dealing with an infodemic. Everyone's got their social media going. They're reading all kinds of things. The quality of a lot of it isn't the best. The experts themselves debate. And the government then is faced with imperfect information about a fast-developing situation. And, governments try to make the best decisions they can, but with the best will in the world, that they're not always going to be the right one. I think where Jacinda Ardern scored very, very highly in New Zealand was that she was always very open about what we were dealing with and also being clear about what we didn't know. I think that that's been critical. You know, governments like to show that they're in command by knowing everything about a problem, but this one was just moving too fast for that. So you had to listen to the consensus of the experts, communicate as clearly as you could to the public what was happening and why you were asking for certain, sacrifices with respect to behaviour to be made. But I think it's one of the most difficult public policy challenges I've ever seen governments deal with.
Yeah, and are we evaluating it? Like, are we looking at the communication early in the pandemic, looking at those outstanding examples like from the New Zealand Prime Minister, like from some of our own leaders in Australia, but also critiquing that communication? Because, Eric, you were saying earlier that the beginning pandemic, people were not taking this seriously. Well, I was in Samoa at the end of the measles outbreak there. They were taking it seriously. They were taking this virus seriously, and that's the end of January. And I know that in public health in Australia, they were taking it seriously as well, but they were not communicating early and often enough with our public, so that once we did, the public are smart. They knew that we had something was coming, and once they figured that out, they started to adapt and try to look for ways to prepare. So what did they do? They stockpiled. And one way to get around that, I know it's always going to happen, but to mitigate that is to be transparent early in your communication about what's happening and frank, and help people to prepare, tell them what to do. And that, I think, is something we need to look back on and improve for future.
It also seems, though, too, that what's been lost in all of this is, the vaccines. A year ago, people thought, oh, maybe if we get a vaccine that works for 50% or, saves us at a rate of 50 to 60% in 2 years, we'll do well. We have vaccines that are working remarkably well, that were developed in record time. There's a lot of cause for optimism, not just alarm. There's a lot of cause for focusing on that.
I think you've said as well, Damien, that we can be a bit hard on ourselves in Australia. I mean, if you look at Australia vis-a-vis the rest of the world, I know, Kate, that the UK right now would love to have our numbers.
Everybody would love to have our numbers, to be honest.
And that Australia has been ahead of the curve. Yes, at the moment there have been issues with vaccination, but 20% of people 16 and over have had 2 doses, and 40% has had 1 dose. Fast forward 5 weeks from now, and 50-60% of Australians are going to have had 2 doses. Is there too much gloom?
Well, I think that part of what happens for anyone, and this is something I had to research for a book that's coming out soon about risk in Australia, is that there's a momentum to risk. And so there was a period of time where Australia was very afraid and locked down its borders. Then there was a period of time where it was very complacent. It thought everything was perfect. And now we're in another period of uncertainty. And what you have to recognize is that that sense of momentum, you have to be able to step out of that and look at the bigger picture. And so I think the political class, the public in general, when you step back and look at Australia in comparison to other countries in the world, it's done remarkably well. And in all likelihood, a year from now, it will still be one of the leaders in terms of how it dealt with this.
What do your friends and family say in the UK when you talk to them about what's happening?
So my friends and family in the UK, when I say we're locked down, in deep lockdown, that's how I describe it actually. So we're in deep lockdown for 200 cases. They can't believe it. They can't get their head around it. But, it is all about context, though. So, in the UK, my family, they're going on holiday, they're, going up and down the coast, meeting each other. It's summer, it's absolutely beautiful. And like I said, but they're coming from a context of absolute horror into, oh, you know what, case numbers are pretty much halved. And look, the really important thing, without being overly gruesome, is actually a number of deaths. I mean, in the end, what you'll see in the UK is there is a disconnect between case numbers and number of deaths. So when case numbers went up in the last surge, numbers of deaths didn't go up. And as case numbers have come down, number of deaths has remained static.
Testing's interesting in the UK as well. Fewer people getting tested?
So testing has dropped, but one thing to make clear, testing has dropped, but not as much as cases have, OK? So cases have dropped massively and testing has dropped a certain amount. Look, testing has dropped because if you think about it, if you're double vaccinated, and pretty much everyone you know is double vaccinated or has had COVID, because that's the other thing the UK has. When you look at the UK, they estimate that 90% of people in the UK have antibodies, even though only 60% have been vaccinated because of that herd immunity, turn left, lockdown, go into vaccine. So look, if you're double vaccinated and summer's coming and you have minor symptoms, you know, and your grandmother and all the people around you have been vaccinated, if you go and get tested, you've then got to isolate for 2 weeks. You've just come out of a long period of isolation. I can see Eric shaking his head.
I just called Eric out the corner of my eye. He's shaking his head absolutely.
Eric, I'm not advocating it. I'm saying that's what's happening, though, if you know what I mean. I'm not saying people should do that. I think if people are ill, they should go and get tested and they should do it. But that is actually what's happening because people have been in lockdown for 12 months and they're like,
Eric,
I don't want to do it anymore.
Do you suspect that people are doing that in the UK, in the US as well?
Well, I think there's a lot of fatigue in the US as well as in the UK. But I think you should not generalize what's happening in the UK to Australia. That would be a big mistake. As mentioned, the ONS UK surveys have shown about 90% prior infection in the UK and 80% in Scotland. But you really have to realize that, you know, the actual number of people who have some sort of immunity of some sort through a blow-through, a burn-through of the UK population, they've suffered a lot. And you don't really want that as precedent for Australia. And I want to remind, so there's a narrative that somehow deaths and hospitalization have become disconnected. No, they are still rising oftentimes together throughout the world. And don't just think about deaths. Don't just think about hospitalizations. Think about long COVID. 1 in 8 people in the UK have long COVID. And 1 in 12 children will suffer long COVID. And 1% of those currently infected children actually get hospitalized in the UK. That is not a statistic that we want to live with. In the US, it's the number of hospitalizations are absolutely surging astronomically. And this is even in highly vaccinated parts of the US where we have 60-70% vaccinated. The percentage increase of those states in hospitalization is actually similar to those in the South right now. Because right now, the Delta is a completely different virus. It's a pandemic 2.0 virus. So whatever we did last year that seemed to work well, discount them. With the reinfection after 180 days is double. Less than 180 days, no increased risk of reinfection if you have previous infection. After 180 days, reinfection rates have doubled. And vaccine efficacy. 2 months ago in Israel, efficacy was 95% with 2-dose Pfizer. Last month, 64%. 2 weeks ago, 40%. Now, that is a combination of Delta variant being so much more evasive and Delta variant being higher viral load and also effect of waning. 6 months after India, so Israel has the most number of people who are more than 6 months since vaccination. We know the waning effects are kicking in. We know that the reinfection risks are really high. And this is why people dismiss the 40%. Oh, it can't be. But you know what? Guess what? UK reported that the efficacy in UK has dropped to 50%, 50-60%, pretty much in line with Israel. That's the Delta variant. It is twice as transmissible in terms of
Eric, I want to make clear.
And it's 4 to 5 times more severe.
Eric, I want to make clear, I'm not advocating what Australia should do, what the UK does, because you can't. Because countries have gone down to totally different ways of doing it, you can't turn around and do it. I'm just saying this is the mood in the UK at the moment, and this is why people aren't getting tested, because that's the reality.
We are seeing interesting patterns in the UK. So there is a reduction in deaths. And everyone's seen that big peak in January, and they had a big peak in June, but the deaths stayed quite low. Now,
even during that big peak in June.
Yes. Yeah. So there is changing epidemiology.
This is because you're talking about high rates of vaccination.
And this is in a Delta environment as well, but they are high rates of vaccination, particularly for older people, where you saw most of the deaths. That doesn't mean that deaths disappear. No. When there's a lot of COVID around, you'll still see people die, but it will be a smaller number of people overall if there's vaccination.
It's a perfect segue to our next question. So many questions tonight have been about this question of opening up, of vaccines, what the future looks like, what normal could be. Our next question comes from Fiona Bruce, who in fact is a doctor based in Melbourne.
We are talking of opening up at a level of vaccination that could lead to hundreds or thousands of cases of COVID-19, resulting in many deaths and people with long COVID and all the accompanying economic damage. Why would we accept this?
Well, why would we accept it, Kate?
Well, there's a lot of assumptions in that question, though, as well. It's not entirely clear in this environment that it will lead to hundreds and thousands of cases.
That's not the case.
Look, it is a question of risk appetite at the end of the day. You know, and at the moment, Australia's got a really low risk appetite, and that has led to a really good outcome. And it's a question for how long we want to keep our risk appetite that low.
But the reality is, Damien, is that if you look at something, again, like the Doherty Institute research, which is saying at 70% you are going to have thousands of cases and you're going to have commensurate number of deaths. At 80%, if you open up and you just open up completely, you're still going to have to prepare for over 1,000 deaths every single year. That's what living with COVID is going to look like.
That's still a death rate that's lower, and you guys know this better than me, that's lower than what flu and pneumonia do every year, right? And so if you talk to people who are looking at this at the very long term, you know, what does success look like? Well, maybe success looks like over the course of 5 years where COVID death rates are similar to flu. That's the one that we always talk about, right? Or what about fatalities on the roads? Or what about drownings? There's a lot of situations where we deal with risk and we accept that there are going to be deaths and there are going to be consequences. If we could get to a place where the death rate is kept at the level of flu and pneumonia, that's an enormous success for humanity. I mean, given the way that this pandemic has gone, that's cause for celebration.
But Julie, that gets to the elephant in the room here, and that is zero COVID. The reality is, if we are going to open up, if you're going to open up at 80% of vaccination, you are going to have cases. If you open up to overseas travellers, you are going to have potentially thousands of cases. You are going to have deaths. Does this mean that zero COVID is impossible?
Zero COVID will be impossible in the future, but we need to be careful with all these predictions because they are very fluid and they will change over time. So one of the figures from the Doherty was that if you're struggling with test, trace, isolate and quarantine and you have 80%, you may get 1,200 deaths within 180 days. Now, that's a really, really nasty flu, right? But it could change as well because looking at the UK data, COVID is looking cyclical, so then it might calm down a bit. So I think, and then hopefully we're going to get 95% of people vaccinated. Wouldn't that be fantastic? Including children. So our future will be different. It won't always be like we're dealing with thousands of deaths from COVID. And we don't want to tolerate that either. So the tricky thing is going to be finding this fine balance between controlling this awful disease enough and also having our lives back. And it's that balance, achieving that balance, which I think requires good governance and consultation with all citizens, with diverse Australia, so that everyone has a stake in what is an acceptable risk.
Eric, I know you want to come in. Just hold that thought because I want to go to Helen Clark and just get your thoughts, Helen, on the narrative of zero COVID. Do we need to stop talking about zero and prepare people for what the reality of even 80%, or if we get to 90% even, of what the reality of that might look like?
Look, I'm speaking from a country where the risk appetite is actually very, very low among the citizens. So I think we have to accept we live in changed times. We have to try and push the vaccination rate as high as it can possibly go. We will need to maintain a range of public health measures for the foreseeable future. We will need border controls, whether it's almost inevitably we're going to want to know what kind of vaccines people have had. Depending on the kind of vaccine you've had, you'll probably be treated differently at the border. You may face, if you're coming from a country that's still a hot spot and the government here doesn't like the look of your vaccine, it may be that you have to pay for quarantine. I think this is the foreseeable future for us. You can't go from where we are, living behind a reasonably protected wall, to saying, oh, well, all's forgiven, come in. I think there's going to be a lot of restrictions around mobility.
Eric, you had a thought there. I know that you've been wanting to say something.
Yeah, so I believe zero COVID is still the right strategy now, but there will be a time we do have to open up, whether it's Australia or New Zealand, but the time is not yet now because vaccinations are just so low, first of all. And by the way, Dr. Mike Ryan of WHO, he said what Boris Johnson's been doing is in all his years of experience running pandemics for decades, is epidemiologically stupid and morally empty. And that's his quotes on camera at the WHO press conference.
This is the Freedom Day.
Yeah, the Freedom Day approach. But because there's more than just, again, deaths and hospitalizations, which absolutely are soaring like bonkers around the world, and in the US, which is most of the states are much higher vaccination than Australia are. They are just out of control. What you also need is, in addition, not just masks, but premium masks. And especially high wealth countries like Australia should be able to provide premium masks for its population. Because it's been required FFP2 masks in Europe for quite a while. In addition, you need airborne precautions, from ventilation to air disinfection. That's been recommended from the CDC, whether it's portable HEPA filters, MERV 13 filters in all public buildings. Belgium is actually recommending CO2 monitors to assess ventilation in all public buildings, as well as upper air UV. All these things the high income countries can afford, they must be done before you reopen, or else you're going to have a catastrophe. And luckily, Australia doesn't quite have such a anti-mask movement, anti-lockdown movement as the US does, although I know you guys have some as well. But if you want freedom, you have to do these other things, or else it is just so irresponsible to just throw caution in the wind and do something epidemiologically stupid and morally empty.
But that's an important point. It's not all or nothing. It's not, okay, we lock down, everyone just stays at home forever, or we throw open the doors and everybody comes in. There's going to be...
It's a staged approach.
But it's not just about staged in terms of timing. It's also about you have a whole bunch of other tools, right? It's a layered approach. You're going to have different kinds of quarantine for different kinds of people coming from different places with different levels of vaccination. All these tools are there that will also build onto the model.
And Kate, if you want to come in on this as well, what this means, though, is that for people, and, all of us here in this conversation are in a reasonably comfortable position to be able to see out lockdown. There are people in the midst of lockdown concerned about their futures who are wondering whether I pay the electricity bill or the rent or put food on the table, where these are real decisions that are to be made.
Absolutely.
I mean, and if we are going to be in a situation where Victoria's gone into lockdown again today with a small number of cases, but a precautionary measure to try to drive it to zero, it means that people are living with uncertainty, disruption, and for some, they're carrying a disproportionate load.
Absolutely, and that's the thing, you sit here and, I get it, it's easy, we throw out all these figures, X number of deaths and rising cases. Real, zero COVID doesn't come without cost,
Exactly.
It comes with huge community cost. It comes with huge community cost in terms of mental health, People talk about Freedom Day in the UK, and I was asked whether I was critical of it, and I said, look, the thing about a government is they're not responsible for just one aspect of what's going on, they're responsible for everything. So you've also got to think, well, what's the mental health of my people like? What am I going to gain by giving people something to look forward to and something to celebrate, versus all the modelling that I've got here. You've got, domestic violence, you've got youth homelessness, you've got people who, you're right, if you sit there and, you're in your job and you can, work and be fortunate enough to come on TV shows like this, and you can wait it out, that's great. A lot of people can't do that. And it's kind of making those decisions for them effectively, kind of say, well, you're going to have to wait until we're more comfortable.
Children in schools is not that difficult. Boris Johnson and Secretary Javid is saying no masks in school, which is just absolutely ludicrous and so dangerous. Like, children should be protected. 1 in 12 children get long COVID. And by the way, the UK's latest study among 81,000 people by the US Dementia Institute was that if you're hospitalized on a ventilator, you lose 7 points of IQ. If you're hospitalized without ventilator, you lose 3.5 points of IQ. Even if you're not hospitalized but have mild to moderate COVID, you lose from anywhere from 1 to 3 IQ points.
But Eric, that's also the case. But it was also the case that in the United States last year, there's a lot of evidence that suggests a lot of those kids could have gone to school and been safe. So you had millions and millions of children who lost months and months of their education. when they probably didn't need to.
It's masked.
It is.
My point is that alarmism has costs as well.
Loss is equivalent to lead poisoning, which is permanent. Lead poisoning, no one tolerates lead poisoning.
But nobody, look, Eric, nobody is arguing.
Eric, just for a moment.
Nobody is arguing that COVID is not bad and does not have impact. That's not the argument. The argument is, how do you come out of it in a way and balance up all the different things that you've got to look after? You know, how long do you stay in lockdown? What's the impact on people's mental health if you stay in lockdown?
And the people are disproportionate.
At what point do you say...
Eric, can I get you to hold that? Can I get you to hold that thought, Eric? Because we do have to move on. I want to get through as many of these questions as we possibly can in the program. Our next question comes from Maria Dunn.
Why is it now possible that in a Western democracy such as Australia, which supposedly values free speech, that it is now acceptable for a major media platform like Sky News to be banned because of what is deemed as misinformation? Some feel it is purely because they dare to go against the prescribed views that are status quo. Why is there suddenly only one acceptable viewpoint and no discussion is now permitted? Have we lost the ability to think critically and reason what is correct information versus fake news?
Damien Kay.
You know, I mean, I think that this act of killing a bunch of videos or removing them from YouTube is really a difficult thing. I think there are times when misinformation needs to be stamped out and where it's damaging and dangerous for society. But in this case, you have a private company that's removing videos, most of which were from a year ago, without a whole lot of transparency as to why they're doing it. And, you know, it's a slippery slope when you kind of allow this to remove. And I keep thinking of historians. When they want to recreate the conversation and the myths and the arguments and the disagreements that happened in that moment, because these are now videos that are pretty old, they're not going to have access to that. And are we better off because of that? I'm not sure we are.
Is there also a question here, Damien, of the media's right to voice opinions, to have dissenting views, for those dissenting views, even if they're unpopular, to be challenged with the facts, to be brought into, you know, the light of proper debate and argument, but not to be silenced?
Well, I do think that's important. I mean, the challenge with these tech companies, though, is it's not an even marketplace of ideas. You have algorithms that are going to be pumping out misinformation if that's what people want, that are going to be favoring outrage over context. And so I think the responsibility on these tech companies is different than it is just on a traditional media company, frankly. But I also think it's questionable to remove anything like that. And what I think the culture really needs is for these companies to be more transparent and for there to be an open process. And maybe we need to think of them as utilities as opposed to private companies.
So if they had a more open process, would you be happier? Because the way I look at it is this: there is no such thing as unfettered free speech. You know, if people say things that are truly harmful, either to individuals or to groups or to broader social outcomes, there's a question to be had. So for you, is it just about the process? You want a fairer process before material is removed?
I think it's important that the process is there, and I think you have the ability to then publicly debate whether or not it's correct or not, or why. I mean, my concern is how arbitrary is it? Why is this video being removed and not that video?
And what are the criteria? What are the benchmarks?
Exactly.
But also in this case, Kate, is, let's talk about Alan Jones, for example, as one of the videos here that have been removed. Entitled to a dissenting view, to say that there is alarmism, to challenge, to question some of the numbers. I mean, one of the things that we have seen throughout COVID is that often the dissenting view has been silenced or marginalised, and we don't have a much more open debate. Are they not entitled to have those views?
Look, I think, you know, I come back to what I say. In the end, I don't believe in unfettered free speech. You know, I think there's got to be, you've got to have some kind of system around it. I think the point that Damien makes is, well, what's the system and can we discuss that? I think what happens when you have the discussion is people start to say, well, people should be allowed to say that, rather than kind of say, well, what's the kind of framework? You know, coming out of this whole thing, for me, there's a few things you've got to think about. So one is our relationship with the state. You know, that's what I really think that the issue is. You know, if we're going into, you know, volatile, uncertain, complex, ambiguous times, and what the pandemic has shown us is really the state is the only machine that can respond. I mean, private companies can't respond in the way that individual states have to this. So as we move into more volatile times, the state and the state machinery, to me, is going to become more and more important. So how do you build a relationship of trust between individuals and the state? So when you move into more complex areas, we can trust what they're saying. We believe what they're saying. You know, that there's people are taught around both sort of media literacy, health literacy, you know, all the things that underpin, you know, how you come out of these kind of problems.
Julia, I'd like to get a thought from you. When you look at something like this as a health professional, you listen to what's reported on Sky News, you listen to what's reported elsewhere. Are you in favour of removing different broadcasters from various platforms, removing people from YouTube?
No, my reasons are kind of strategic. So I look at this, you know, in the pointy end being with vaccination, where there's a lot of concern about negative media, social media, scaring people off vaccination. But the research that we do with people who don't vaccinate doesn't have in their stories an account of them seeing something on Facebook and it putting them off. It's much more complex than that. And I think when we think about the influence of misinformation in particular, we need to think about the environment in which that misinformation sets seed. And if there's mistrust, if there's a lack of justice in the way people are treated around in healthcare or around vaccination, for example, if there's an adverse event following immunisation, then people can be more attracted to those messages.
And that's what we've seen throughout COVID, questions about trust. Our final question comes from Paul Martin.
The SARS-CoV-2 virus is very sneaky, spreading between people before they have symptoms and when they have mild symptoms. Almost every country in the world has failed to contain this virus. It also seems likely it was spreading outside of China even before it was first identified by the Chinese scientists. Has it been indeed unfair and unreasonable for those who blame China for not containing the virus, because they must think that China is so much better than all those other countries that didn't contain the virus either?
Helen Clark, your report said this was a preventable disaster. Part of being able to prevent that is transparency and honesty, and that's what was lacking, wasn't it, in the early days in China, where people who would blow the whistle were being targeted and silenced?
We saw that reported, of course. We also saw reported that when the doctors in Wuhan noticed the cluster of these cases of pneumonia of unknown origin, they did get testing done, and there was obviously information put into the public health arena about these cases. But there was a slowness to act in China. We looked at the whole month of January. We felt that the WHO didn't have the powers it needed to deal decisively with a situation like this. We felt that the public health emergency declaration of international concern could have been made earlier. But then we go on to say that February was a month of missed opportunity for most countries in the world, when they should have been readying their defences and rather sat and watched. So there's so many lessons to come out of this pandemic. Be prepared, take WHO warnings extremely seriously. I hope every country now will review their experience with COVID, look at where they went wrong, and resolve to do better next time a threat arises. Because we can't stop the threats arising. What we can stop is them developing into a catastrophic pandemic like this one has been.
And Eric, the fear is, of course, that there will be another potentially as well. We've already seen, I mean, you've spoken about, you know, a pandemic 2.0 with Delta. What lessons do we learn in our ability to be able to work together? And particularly, I think, given the alarms that you raised earlier about China and questions about where this emerged from. There is still debate about whether it emerged in a lab or whether it emerged in a wet market. Now we're 18 months or so into this. What have we learned and what do we need to build on for the future?
I think the origin debate is beyond the scope of this discussion, and I think we won't be able to have the answer for a while. And it's true that they've detected SARS-CoV-2 in Italy around Milan
September,
back
I think
in
that was
October, November. Yeah. Right, but I think the biggest failure is not what happened or how it started. We are going to get more pandemics of some sort of origin from animals at some degree. Many animals in the world already carry SARS-CoV-2. I think we can't avoid more pandemics in that sense. But what we can prevent is the catastrophic failure of our society to collectively come together. And this is not just criticism of people, but also of governments. Governments want to look at the other way. They don't want disruption of the stock market. They want for things to keep open. And I think, that's a good thing. But at the same time, they completely dismiss, just like we all have our biases. We want to dismiss the things that are not the inconvenient truths, to borrow a phrase, so to speak. And I think that happens, that's human psyche. And to prevent that, we really have to face things head on. That Dr. Mike Ryan, again, I cite him a lot because his philosophy that if you want to be right before you act, you will lose this pandemic. Perfection is the enemy of good. And I went to Geneva and spoke with WHO headquarters leaders just last month. And they are still very much in the precautionary principle. And they said that's what countries should really learn. The precautionary principle is the best way to defeat the pandemic. Not complacency, not basically hopes and dreams and prayers, because those are not strategies in a pandemic, especially something that has long COVID implications that will harm our economy and our costs of our healthcare system for decades to come. And I think our children are the future, and we should go send kids to school, but with masks and ventilation.
Okay, we've certainly made that point. Just on that point about children, you have children here, Damien, and your children have lost a couple of years of their lives, of not being able to be around family, not being able to visit the United States. What are these other things that we have lost and the impact it has particularly on children?
Well, I think it's important to think about costs that are not economic. Birthday parties that were never had, family gatherings that will never be replaced, that never happened. Funerals and weddings that were delayed and that were shrunk in size and where people never really got the closure that they wanted. And I think there are enormous costs that we don't often think about when we're thinking purely in terms of opening up as an economic thing. And for my family, my
children
kids
have missed their grandparents.
Yeah, my kids haven't seen their grandparents in longer than they've ever not seen them. They haven't seen their cousins. My children are, growing from little children to teenagers at a time when they're not able to see their family at all. And I know that my family is heartbroken about that. I'm heartbroken about that. And I'm far from alone. There are so many people in much more difficult circumstances than me whose families are disconnected. And I'm not sure that Australia has ever really fully grappled with that. That what you're doing to a certain extent is keeping families apart. And yet the hope is, if we do this right, we can all come back together and do that. And that's perhaps what the message that also isn't being said, is this isn't just about protecting, your family from getting hurt and from getting sick. It's also about being able to bring our families back together. The more people get vaccinated, the more this country handles this well, the more unified families in Australia can be.
Stan, I think that as we look back on the lessons from the last year and a half, one of the things that we should be doing is looking at the strengths of where things have gone well, where communities have cooperated well. We've seen an amazing cooperation from Australians. And I love the example First Nations communities taking leadership right at the beginning, working with Aboriginal community-controlled health services, high-level cooperation between government and peak bodies that meant that Aboriginal communities were leading and are a global example of how to control COVID.
Yeah, it's a wonderful note to finish on and to remind us that the people who have been the foot soldiers in this, the people who have carried the load and the people who are going to get us to the other side are ordinary Australians, people who have made all of those sacrifices. Thank you all so much for being part of our conversation. That's all we have time for. Thanks again to our panel, Kate Mills, Helen Clark in New Zealand, Damien Cave, Eric Feigl-Ding in Washington and Julie Leask. And thank you all for all of your stories and your questions. Next week, David Spears joins you live from Melbourne. Until then, take care. Have a good night.